Hello, Dr. Joe here of the 2020forum.com. So, following the recent passing of a fine gentleman, a fine actor from colon cancer, I had quite a number of queries regarding the signs and symptoms of colon cancer, the red flags to look out for, and I thought I'll do a quick educational video on the subject. So, in this video, we're going to be talking about what is colon cancer, the signs and symptoms of colon cancer, and the risk factors associated with colon cancer. Now, annually in the US, there are 147,000 cases of colon cancer and rectal cancer cases a year. And of those, actually 12% are happening in young adults, people who are under 50. And indeed, I was talking to a colorectal surgical colleague of mine the other day, and he was talking about how they're picking up colorectal cancer cases in young adults and people in their 20s, which is quite astonishing. So it makes sense to watch a video like this so you become aware of the signs and symptoms, the risk factors, so you get yourself screened early, because early detection is the key to surviving colon cancer. So let's get started. First of all, what is colon cancer? Well, colon cancer is when you develop cancer cells on the lining of the colon, okay, the inner lining, anywhere along the length of the colon. So let's look at a brief anatomy of the colon. So what you've got here, okay, this is the ascending colon, okay, because it's going up, and then you've got transverse colon because it's going across, and then you've got a descending colon, okay, and that goes down to the sigmoid colon, and then of course the later part of the large bowel, what we call the rectum. So any cancer that happens along the length of the ascending colon, the transverse colon, the descending colon, sigmoid colon, and the rectum is colon cancer, basically. What do they look like? Well, here is what a colon cancer may look like. Here, this is the inside of the bowel, by the way. So you can see this is the lumen, and then you got a cancer growth here. Okay, this is a cancer growth. Okay, so that's one way it looks, and here is another way that it looks. Okay, this is the inside of the bowel again, the lumen of the bowel, and then this, you can see here, this is a cancer growth arising from the lining of the bowel here. Okay, so that's what they look like. So essentially that is colon cancer. So what about the signs and symptoms? Let's look at that. Now, symptom number one is rectal bleeding. Sometimes you're probably going to see this more with rectal cancer, but when you have your underwear getting stained, you've got rectal bleeding, that's something to alert you, something to look out for to get yourself screened. Symptom number two is change in bowel habit. So if you're somebody who goes once a day, and then the next thing that's happening is you're going about 4 or 5 times a day, or you're going once every 5 days, that's a change in bowel habit. You're getting constipated, you're having diarrhea, that's a change in bowel habit. Now, it's not a one-time thing. If it happens just once, it's not a problem. But when that is happening over a prolonged period of time, then that is a red flag to look out for. Okay, change in bowel habit. Symptom number three is abdominal cramp. Well, this is not specific to colon cancer. There are many reasons why you could have abdominal cramps, but if you're having abdominal cramps along with the other symptoms, then it will make sense for you to get yourself screened. Okay. Symptom number four is unexplained weight loss with or without loss of appetite. Okay. If you're losing 10, 12, 14 pounds and you're not really dieting, and your appetite is poor, then and you got some of the other symptoms, then it will make sense for you to get yourself screened. Okay, so that's symptom number four. Symptom number five will include blood in stool. Okay, so you do your number two, you have a look, and you see blood there. Not very good. And sometimes you might not see blood, but the stool is just dark. Okay, when you see that, then that should also alert you, especially when you got the other symptoms as well. Okay, so those are the symptoms of colon cancer and even rectal cancer. So what are the risk factors? What are the things that put you at risk of developing colon cancer? Now, for a start, all of us are at risk, okay? But some people are more at risk than others. I'm just going to talk briefly about the risk factors. And in particular, I'm going to talk about the risk factors that are sort of unavoidable, that we don't have much control over. So let's go over them. Risk factor number 1 is inflammatory bowel disease. So if you've got Crohn's disease, if you've got ulcerative colitis, that puts you more at risk of developing colon cancer because of the chronic inflammatory condition that is going on the lining of the large bowel there. Okay, so that's one risk factor. Another risk factor is polyps in the colon. Okay, if you got polyps, when they have a look and they see polyps, that also puts you more at risk. Risk factor number 3 is age over 50. I've talked about this earlier on. Colon cancer tends to happen more in the over 50s. So if you're over 50 and you got some of those symptoms, makes sense for you to get yourself screened. Family history of colorectal cancer. Okay, that of course is fairly obvious. If you've got a family history, then your risk is higher than the man next door. Then history of breast or ovarian cancer. Okay, they're linked. So if you've got a history of breast, if you're a lady, you've got a history of breast of ovarian cancer, that also puts you more at risk of colon cancer. Okay, so those are the risk factors. What about the diagnosis? What can we use to screen ourselves? Like I said, early detection is the key. So if you've got some of these symptoms, if you've got those risk factors, then of course you need to get yourself screened as quickly as possible. So the first screening tool we have is the fecal occult test. So you send your stool sample to the lab, they'll have a look at it. If it is positive, they'll let you know. Also CT colonoscopy. Okay, CT colonoscopy. This is a virtual screening. Of course, the main advantage is that it is non-invasive. You just have your CT scan and they take slices of the colon, they have a look at it. If they see a lesion, then you're going to require further investigation. Next is barium studies, where the barium is injected into the bowel from below, and then they take X-ray shots. This is the old reliable way we used to do it, you know, in the good old days. And of course, if there are filling defects, that will imply that something is going on around there, and that will require further investigation. Next is colon biopsy. Colon biopsy is obvious. You have a colonoscopy where we go in there. If we see any lesion there, we resect the lesion, send it to the lab. The pathologist will have a look at it under the microscope, and then of course will tell us whether it's cancerous growth or not. Next screening tool we have is, and this is the old reliable one, colonoscopy. It's probably one of the best tools available because we can actually introduce the colonoscope inside the colon. We visualize everything, and then if we see anything suspicious, any area that is suspicious, we take a biopsy, and then of course we send it to the lab, and they will tell us if it's cancerous or not. So these are the screening tools we have. They are available at your disposal. Use them whenever. See your doctor, and he or she is going to be the one who's going to initiate the screening. So that's about the bit I wanted to talk about regarding colon cancer today. Now we know what is colon cancer. Now we know the symptoms. Now we know the risk factors and also the screening tools available to us where we can actually make the diagnosis of colon cancer. So if you got some value from this video, as usual, please give it a thumbs up. Now tell me something. Have you had colonoscopy? Have you had any of those screening tools we're talking about? Have you had any of those symptoms, by the way, and you got yourself screened? What was your experience like? I'd like to know about it. Please leave your comments down below, okay? If you haven't joined us yet in the 2020 forum, please do join us. Over there, we discuss wellness issues. Also, please share this video with your friends, family, and colleagues. Now, there should be 2 videos on your screen now. Click to watch any of them. They are videos designed to enable you to take control of your health. I think that's about it for this video. Hopefully, you got educated regarding colon cancer. Until next time, this is Dr. Joe signing out.